All right, welcome everyone to August, the Wisconsin Coalition for Social Connection August Network meeting. Thanks everyone for joining. We're just going to get started with some brief introductions. So for those of you that don't know me, my name is Suzanne Morley. I'm a health promotion program coordinator with the Wisconsin Institute for Healthy Aging, and I coordinate the Wisconsin Coalition for Social Connection. So like we do every meeting, we'll start with just a round of chat introductions. If you want to just put your name, your organization, and then what are you most looking forward to this fall? So go ahead and drop that in the chat. Hard to believe it, but it's almost September and the leaves will be changing. The thing I am looking forward to most this fall is taking my son apple picking. I came with a picture. This is us last year. He clearly wasn't very happy about going apple picking last year. So I'm hoping this year we'll go to the orchard and he'll have fun doing that. We look forward to the apple cider donuts every year too. I'll just give everyone some time to drop theirs in the chat. Linda looking forward to Cranberry Fest, hikes in the woods, yes. Looking forward to that too, the cooler weather. Looking forward to the colors. Can't wait for Halloween. Hopefully we'll see if anyone dresses up. See some pictures, Packer season, yep. More hiking, looking forward to making soup. Ooh, that sounds good. Crisp Other Walks, pumpkin flavor everything. I love it. Again, looking forward to Halloween. Ooh, seeing my daughter play collegiate field hockey. That sounds fun. Pumpkin carving. The Brewers postseason. Again, more votes for pumpkin spice flavored everything. Snuggly sweaters, cooler weather, and less bugs. The mosquitoes have been awful this year, so I'm looking forward to that too. Looks like lots of votes for pumpkin spice and cooler weather and fall hikes and then fun colors. All right, well, the chat's slowing down a little bit. So again, if you're joining, feel free to introduce yourself in the chat with your name, your organization, and what you're looking forward to most this fall. But we'll move right along with our agenda for today. So first, we're going to go into a round of coalition updates. Then we'll hear from Michelle and John from Brown County. And then we'll get into some small group discussions after Michelle and John's presentation. Super excited for that to allow some time for networking and some open discussion. And then we'll wrap up at the end after that. But I'm going to jump right into our coalition updates, and I will let Janet Zander take over for the first update.
Good afternoon. Thank you. So one of the things that we have been hoping to do is utilize the expertise of this coalition to advance some policy initiatives that would, in fact, help people stay connected to their communities. So we have put together a group of policy champions. And these policy champions, so far 10 people have identified an interest in serving as a policy champion. These are folks who are older adults, people with disabilities, so people with lived experience, as well as professionals who serve those populations and any underserved populations. Our purpose would be to gather some information about various policies and initiatives, and these things could be lifted up by the coalition itself or by our various organizations that are involved in doing the work, or by people, again, with lived experience, that we might have an opportunity to analyze those policy and initiatives and make some recommendations to the full coalition, as well as what's being created as our decision-making team to decide, is this something our coalition wants to weigh in on? What's an example? It could be transportation funding in the upcoming budget, for example, a way to make sure that people have more opportunities to get connected to their communities through transportation. One of our new policy champions suggested a change in statute. She was aware of a statute that allows people with disabilities, developmental disabilities, to obtain fishing licenses as a group. So imagine an adult family home or a CBRF wants to take some folks fishing. There is a group licensing offered by the Department of Natural Resources. Wouldn't it be fabulous if that state law language could be modified to also include people with infirmities of aging or people with dementia, so that those individuals could also gather together and do something that may have been a beloved pastime that is not something easily accessible to them right now. And so again, it can be big things, little things, but things that would really help bring people together and create some feeling of belonging and purpose. So we're looking for great ideas. I think the benefit of the champions is that everybody comes with a little bit different perspective. So we might have a wide variety of ideas we'd be looking at. We would pass our recommendations on a particular piece of policy onto a group called our decision-making team. And right now we have 5 people who have potentially identified themselves as being willing to meet on an as-needed basis to review our recommendations and and then pass along those recommendations to the full coalition. Our policy champions group, we think, would probably meet monthly. These would be virtual meetings. I'll be looking for somebody who wants to co-chair that committee with me. And then we would not only be making those recommendations, but if the full coalition decides to move ahead with something, we would be helping to create some action items. How can people engage with various policymakers at the local, state, and federal level to forward these initiatives? So I'm really excited. I'd like to get the group together. I'm thinking about sending out a doodle poll or some version of that by the end of this month so that we could get our first meeting scheduled well before the next legislative session starts and we're in the thick of the budget process. So if this sounds like something that might be of interest to you, please let Suzanne or I know. We'd be happy to add you to the list. And I really am excited that we might have a workable solution for this group to really advance policy initiatives that would help people stay connected to their communities. Happy to answer any questions anybody might have.
Thanks, Janet, for sharing that. Super excited for this to get started. It's been fun working with Janet to kind of get the people engaged. I've been doing a lot of one-on-ones with new coalition members and have found that a lot of people have interest in doing this work or experience already in doing this work. So really excited for that committee to get started.
Me too.
If there's any questions, I'll leave it open for a couple seconds. But like Janet said, feel free to reach out to me or Janet if you're interested or want some more information on the Policy Champions Committee.
Janet, do you recommend that people have advocacy experience, or can somebody brand new participate?
Somebody brand new could also participate. I think part of the joy of this is that some people will have some professional or personal background with this, and others will come with a passion about a particular issue or something that's important to their life based on experience. So I think both are beneficial in the group.
I see a question in the chat about sending that information out. So I can share that in the newsletter that goes out after this meeting with the recording. I'll make sure that information's in there.
And feel free to, we'll continue to provide updates to the group based on the work of the policy champions. And at any point, if that sounds like something you might be interested, you can always jump in at a later date as well.
Awesome. Well, thanks, Janet.
Yeah,
other questions, feel free to drop those in the chat. Otherwise, definitely we'll share out more information after this meeting, and you can always reach out to Janet or I with any questions too. All right, the last coalition update that we have for today is just, again, another reminder for a save the date. If you haven't seen this already, we are holding a Social Connection, Social Isolation and Loneliness Awareness Week Summit in November. So the Awareness Week will be from November 10th to the 16th. And then we'll be doing free Lunch and Learn webinars on the weekdays. So Monday through Friday, the 11th through the 15th, from 12 to 1:30 each day. Our awareness ad hoc committee is finalizing speakers. We have the topics figured out for the different sessions. We're just looking for speakers currently. But the topics that we'll have the webinars about are around health equity, accessible recreation, technology, intergenerational programming, and then coalition building and community partnerships. So we're really looking forward to this Awareness Week Summit. More information will be coming out about this as we finalize the details. But for now, just save those dates on your calendar. We'll also have other ways to connect throughout that week as well. We'll have the social media campaign, newsletter articles, and other opportunities for discussion. But really looking forward to these webinars and hope that you all are able to attend. All right, then we're going to move right into a presentation from Michelle and John from the Aging and Disability Resource Center of Brown County. So welcome, Michelle and John. Feel free to take it away.
All right, thank you, Suzanne. Are you going to cue the slides then for us?
Yep, just let me know when
That
you want
would
me to
be
move to the
great.
next one.
Sure. So good afternoon, everyone. Myself and John will be tag teaming today. I came into the agency as some of this initiative was already underway. So John's got the history of when it first started too. So I'll cover the first few slides and then we'll switch over to John. So we're going to talk today about the isolation and loneliness questionnaire that we implemented in the agency. And if you want to go to the next slide, we'll give you a brief history of how it started. So the beginning with our agency is in the summer of 2022, we started a pilot that was specific to the 3 staff areas that you see there, the ADRC specialist, nutrition, and our prevention staff. We were using the UCLA 3-item loneliness scale. Prevention, very soon after though, and you'll see from the data, very soon after, we transitioned to using a separate database for Qualtrics, and then we found utilizing the 2 questions below, pre and post, were more effective for us in the prevention world. So we went a slightly different direction to assess with our individuals engaging in our prevention programs and how they were feeling about their isolation and loneliness. The formal screening began in May of 2023 with those above groups that were listed there. And the 3 questions, if you're not familiar from UCLA, are the ones listed below there. Next slide, please. So some of the summary of the data, and thank you to Sarah Ritchie too from UW Extension. She was helpful in helping us collect the data through Qualtrics. So thanks for your assistance on that, Sarah. But this is a summary of all of the data that we took in during that time. And then we'll share some findings that we had from this as well. So from May of 24 through on 2023, all the way through July of this year is what this data is reflecting. So if you look at the different programs where the individuals were screened in each of these areas of our agency. So for instance, under caregiving, how to read this chart across, you can see the data. We had 106 individuals that were screened. Out of that screening, if they had a score of 6 to 9, then they were at high risk for isolation and loneliness. So out of that 106, 44 scored high risk. Which is 41% of that total. And then out of those individuals, how many were given resources? And 100% were, so you can see the 44 there. And then out of all the individuals screened, how many were given resources just overall, whether they were high risk or not? And you can see the 91.5%. So that's how you read this particular chart. And so for us, it was interesting for a couple of reasons. We looked at the numbers. When we got our raw data, we asked questions like, okay, we clearly know that there's more data and more people coming in. So what is that telling us? And we'll talk about some of our learnings and next steps shortly with that, because we certainly had more individuals coming in. But as far as this pilot program and implementing it, this is our initial data. And then like I mentioned all the way through, you can see our INA experience, those appointments, our nutrition assessments, the reassessments, options, counselings, and then like I mentioned, prevention switched pretty immediately into a different practice with that. So next slide, please. We also, in the data that was collected in Qualtrics, we could break down with male and female, and you can see the difference of the amount of people that came in where they fell in the gender piece of things. So fairly close that way. And then if you look at the table, the individuals that came in identified with these categories or definitions as well. So you can see the folks that we were serving. Then if you go to the next slide here, just wanted to show also when we move to the prevention questions that I had mentioned, the first question on the left is, I feel less isolated after participating in this class. we collected basically 3 years of data. So in 2022, we had 353 people, and 56% of those said, yeah, I feel less isolated after engaging in this program. In 2023, that number, we surveyed a lot more. It became a standard protocol, and it is. Through every one of our programs that we do, we're asking these 2 questions now. And 448 people completed that. And then that was 64% of folks out of all those folks that completed this said, yes, I am less isolated. And then on the 2024 data, it's year to date. So these are calendar years, and this is reflecting just from January on through the end of July. So we will obviously have the numbers move up as we finish out the rest of this year. So we have a lot of time yet to reflect some of those numbers. And then the second question was about the class, providing connections to others similar as to theirs. And you can kind of see the numbers there. So it was really interesting to ask these 2 questions, because when they have been engaging in prevention programs, that by default helps them not just in that program, but they're ending up getting connected to other programs too. And that's another piece of what we're working on and tracking on. How many programs are people engaging in after they initially make contact with us? So that will be additional data that we track that comes out of what we've discovered so far from this pilot. And then if you want to go to the next slide, we'll start talking about some of the learnings. And I'm going to have JP jump in now, because he was part of the initial pilot program when this is implemented, and I didn't come on till later. So we'll have him jump in on what the folks in his world have learned from this.
Sounds good. Thanks, Michelle. So while we were doing this, I just kind of want to paint the picture of when I would be asking these questions. And a majority of them, as you can see in the statistics, is that I'd be doing options counseling. So I'd be going out to a person's home, and then while I'm doing options counseling, we're going through kind of a series of different topic areas. And one of them was, like, what do you like to do for fun? And one of the things that we did was, with using motivational interviewing and asking permission, we would ask these 3 questions. And then after these 3 questions, we would try to take them the next step to see if, and this is kind of where we're going in the future, is, how do we move that pendulum of change? How can we move them from identifying and almost like accepting that, hey, I'm feeling isolated and lonely, to what is an action step I can take, and how can we, the Aging and Disability Resource Center, be a part of that assistance? So talking with a lot of the people, a lot of times it was interesting, because they didn't expect us to talk about socialization. They expect us to talk about, how to help, how to get mom up and down the stairs, or how to get her to the medical appointment, or, trying to get her meals with homebound meals. So when we were talking about this, we explored a lot of different areas. And what we did find out is, there's a lot of passion for them to at least rekindle what they used to do. But there's a lot of ambivalence with reconnecting with new areas. So like one of the easiest softball action steps I would do is coming down to the ADRC and having lunch with us. And a lot of times people would have difficulty or challenges, not for transportation, but just the willingness to come down. They definitely opened up the conversation with our other programs, with prevention and the dining and other special events that we had here, especially when we're exploring like falls prevention or memory, like doing memory screens or any type of our memory events. The one of the blessings that we have here in Brown County is we have an abundance of different classes and programs, whether it's social, educational, or prevention, that you almost can. I would find myself easily being able to offer a few classes, or at least a few ideas of them to ponder. The other thing is, with the prevention programming, what was nice about that, even though I wasn't a part of that, but when Michelle and I were talking, is you had a captured audience already. So as we get in kind of the next steps, and with what we've kind of learned from, we want to move on to the next slide. This is where we kind of see our shortcomings of what we were trying to do. And the first one was, even though, we offered training with this, we encouraged this, and asking these 3 questions, even though they are a negative connotation when you're asking them, but it's evidence-based, it still is 99% easily given. I can always tie that into a conversation. And I never had anybody that said, no, I don't want to talk about that. So what we're focusing in on moving forward is how can we get our entire ADRC specialist team to be asking these questions on every options counseling appointment. So every home visit, you should expect to see these 3 questions asked. We are training new people, new staff as they come up. We're trying to give them the why of why this is important, why these statistics are important for us, not only for our programming, but also for the state level, and possible grant funding. So even though we've been doing this for a year and a half, we still have a lot of room for growth. So let's go on to the next steps. So, do we want to have an orientation for options counseling for new staff, and the why behind the tool to gain the buy-in? That's definitely one area we want to look at. I know that we've done options counseling training, and is this something that we want to take and do it statewide as a standard practice, and to bring this into our standard training as an ADRC specialist? Now, once again, I'm not talking about speaking primarily for the ADRC specialists. I'm not talking about nutrition and homebound meals. I'm not talking about our prevention. I'm just talking about, options counseling and doing the long-term care functional screen and giving out information and assistance. Definitely, I always joke with the customers I work with about, I like to give homework, when we meet. That's one of the things that I ask when I go out to a home visit, even though we're voluntary, and they can absolutely say no. But what is that next step? And I just ask them by using motivational interviewing. I don't tell them what to do. I don't bring it up, but I at least steer that conversation into, what do you think you can do next? What do you think would be a simple step by next week or next month? The monthly data updates to the team on screening and resources to improve consistency buy-in. We're going to review this on a monthly basis, which will be good, because then we can definitely see and address people that might not feel comfortable in asking these questions for one reason or another. And then also identifying the gaps from clients on continued isolation and create solutions to address. I'm going to go back to that, getting that pendulum to swing to them finding their willingness and allowing them the self-motivation, but using us and the resources that I'm just going to use that Brown County has to make it easy for them to address that and achieve that small change, whatever that is. We are going to be focusing in the fall on the stages of change and how we can use motivational interviewing with change talk, and how when we're talking with customers and families, when we hear that change talk, how we should kind of really almost stop everything and focus in on what that change might be, such as, if they say, well, I should be doing this, or I really want to be doing that. Okay, let's stop right here and let's focus on what do you really want to be doing? And a lot of times it might be going back out to eat. It might be going back fishing again. It might be reconnecting with friends that are, at a different assisted living facility that's way across town. how could we address that to get them connected with that? And then as Michelle will always do is with the prevention and continuing with that pre and post data because those classes are very heavily attended. So I'm going to send it back to you, Michelle.
Next slide, then if you want to go, Suzanne. Yeah, so the moving forward questions, it's kind of a bigger picture question here too, as far as do we want to continue to assess clients with diagnosed dementia? You know, per that memory screen guidelines with the Alzheimer's Association, we really are not to administer to any clients with an active diagnosis. So could there be a potential interpretation challenge with this clientele on that isolation and loneliness? And then JP brought that up a few minutes ago about the same for options counseling. Are these questions going to become standardized? Like, what's the big picture plan here? Because, you know, as we ask ourselves, what benefit did bringing these 3 questions bring to working with clients? And there has been significant benefits, getting clients to articulate that's where they're at. And then to JP's point of helping them to identify, you know, an action plan to help them move forward on engaging in whatever way they are most comfortable at that moment to do so with stages of change, that can actually really affect a customer's outcome, a client's outcome. And we can see real change happen. And it's about having a strategy that's standardized to get folks engaged in activities, events, people, moments where they can reconnect again. And there's a lot of strategies happening that all of our agencies are doing that are happening across the state with multiple organizations. But if we're going to move forward with standardization, we have a bigger picture question here. What does that mean beyond just our agency? How are we going to use these tools and what could they look like? So I think there'll be continued discussion about this. What is it going to look like? How will we interpret whether we're making an effect or not? One thing that I'll point out too, with meeting, and this even came up with some of our legislators with some of the advocacy events we did. A lot of them were asking questions about outcome measures. You know, what's your data? What is your data telling you? How do we know if your programs are effective? And I think this topic of isolation and loneliness, and if we're making a change in people's life, I think that in the future certainly will have some impact to being able to show on a larger picture, whether it's advocacy or for other reasons, that folks who are engaged in programs like this, if they see change, well, those are your outcome measures, and you want to be able to show that kind of data too in the future. So just concepts to contemplate. I think, Suzanne, that's our last slide. So the next one I think is just the thank you and any questions, but we appreciate you hearing us as we're on the journey. We have some work to do. We've identified some things where we want to improve to get it to be consistently used and standardized in our agency. And so more to come.
Awesome. Thank you both for sharing about your experiences using this UCLA 3-item loneliness scale and suggestions and thoughts moving forward with your agency, moving forward with using it. Really appreciate you sharing. If there's any questions, feel free to come off of mute or put those in the chat. Leave it open for a couple of minutes here for questions.
I have a question.
Go ahead.
Are with their classes, are they doing it over the length of the class, or if the class is just one day at the beginning of the class, at the end of the class, how are they doing those surveys?
Yeah, the surveys that we're administering are for our classes that are session-based over a length of time. So whether it's 6 weeks, 8 weeks, 10 weeks, whatever, it's over time that we're doing that with the classes. So for instance, like we did administer it with a healthy living with diabetes class, mind over matter class, bingo size class, walk with ease class, those that are bringing people together for a length of time.
Yeah, because we're looking at, we started doing something like this for our senior center. So it's interesting just to hear how you guys are doing it and incorporating it a little differently. So thank you for your work.
Sure.
Great question. I see Kent, you have your hand raised. Go ahead, Kent. If you're talking, you are muted.
now I'm not on mute. Of course, this is being done with an existing program in options counseling and prevention and so on. But have you thought to use this as a part of the state required listening session process?
Do you mean specifically like when you're putting together the aging plan, or which listening sessions are you speaking about?
There are requirements, at least there are within Milwaukee County from the state, that we participate in listening sessions that assess the effectiveness of the quality of long-term residential care. And generally we ask questions that are about for rather general sort, and they're not necessarily organized in such a way from year to year to notice whether situations that have been identified, gaps in service or concerns with regard to quality, have actually been addressed over time. So if we go into every 2 years, you may be thinking about the agency aging plan, but if you're doing it in that context, might these kinds of questions be introduced as an aspect of that ongoing assessment?
Yeah, actually, I can only speak to the focus groups for the aging plan because I haven't been involved in because I'm newer to the agency. I haven't been involved in the specificity of other listening sessions that you're speaking about, but I can tell you that over this last year, I have been involved in some of those focus groups and listening sessions per se with a multitude of populations and groups, and we have asked these questions. We have asked questions related to isolation and loneliness, and sometimes we didn't even have to ask the questions because
yes,
the participants readily offered the information and said, how can you help us now? We still are feeling this way.
Yes, that's certainly been our experience here, particularly over the last two area aging plan development processes, but it hasn't been organized in such a way as to gather the information and build on it for future plans and calibrate to the degree of effectiveness of our interventions. And it seems to me that might be useful if we were to sort of introduce this dimension of interaction into an existing program, whether it have to be public listening sessions or focus group listening sessions. I think it's very useful for me to see that you're tracking this information that you're gathering from year to year.
Yes.
So that it's not simply left as a single incident, because we want to see if what we do as interventions actually provides us with evidence to suggest that it's useful or that it's not.
Yes.
Very helpful.
Yes, I agree with you. I think much more discussion is going to need to take place, because when you can track this information over time, then you're showing the efficacy of what your interventions are. But without doing this and tracking it over time or making it standardized, then you're kind of back to, we think it's working great, we think it's helping people, but you want to have that correlation to the data to help you inform your decisions about what you choose to offer, maybe when you're going to choose to offer it, what are the interventions, when's the right time to do it. Okay. All of those things are relative and relevant. And for us as well, some of the things when we looked at the raw data told us we have some work to do. You know, we need to have it standardized with the entire staff team. We need to be very strategic about the training plan for any new staff. So it helped to reveal to us where our gaps are and where we can focus our energies. And our plan is to continue to track this now over time, making those improvements so that we can establish a much stronger foundation for what are we doing? Is it working? How is it helping people? That kind of thing.
Yes.
I just wanted to mention, and I think our other group has talked about the UCLA, and that we just want to be cautious that this is researched as a screening tool and not as a assessment tool of kind of the efficacy of programs. So while I think you're changing it a little bit, you know, we're because I know we're going to discuss kind of this UCL screening tool and the breakouts, but it really was meant to only be an assessment tool. And so, you know, it's not really research based to provide that kind of pre and post. So just being cautious of that. And then I'm Sally Fleshberger. I'm with Disability Rights. I'm with the Wisconsin Board for People with Developmental Disabilities. And we did test the UCLA with some service providers and long-term care who are serving people with disabilities. And we did find that, you know, we had to provide additional explanation around the questions and just give some more context about what they meant. But it was still successful, and I think a tool that was worthwhile for sure.
Thanks, Sally, for providing that context. And I wanted to say too, what Brown County was sharing about they're having and collecting this data, but then they're also thinking about that next step. If someone screens high, that they are socially isolated or lonely, they're providing resources, they're having that conversation about them, what's next? What can we do to reduce that? And that's an important step here. So thank you for your presentation and all the useful information. I'm going to jump into our breakout rooms now. We have a number of questions that we wanted everyone to kind of just think about using the UCLA 3-item loneliness scale. If you're currently using this, how's it going? If you're not using this tool, where could you maybe implement it into screening, like Sally was saying, into that assessment piece? What barriers to implementation might there be? And then again, how do you move beyond that screening into next steps and providing resources and interventions? So we have a couple of leads for our breakout rooms. Myself, Erin, and a couple other coalition members are going to lead these breakout rooms. I'm going to put these questions into the chat here so that everyone can see them. I don't know if they'll translate to the breakout rooms or not. So breakout room leads, if you guys want to copy and paste these before we go into the breakout rooms, that would be great so we don't lose them. But Erin has assigned breakout rooms, so we will go into that probably for about 10-ish minutes. I know this is a lot to kind of discuss in such a short time, but we'll go to 10 to 12 minutes and then we'll come back and then we'll have a breakout room leads, just kind of do a recap of the discussion. If you could take some notes, that'd be great too. And then we'll wrap up from there. So I will go ahead and stop sharing. And Erin, if you could open those breakout rooms, that'd be great. All right, I see everyone quickly coming back. Let's give it just another second or two before we go ahead and debrief. I know that time went way too fast, I feel like. There's a lot of things to discuss, but they got some good things out of it. So I am going to go ahead and just call quickly, just 1-2 minute brief overview of what your group was talking about. So I'm just going to kind of look for my breakout room leads here, and I see Carmen first. Do you want to just kind of briefly share what your room was chatting about a little bit?
Sure. So in our group, there wasn't anyone who's currently using this tool to screen, but we had some more informal screening that's been going on. In RSVP of Dane County, they have an annual survey they do with their volunteers, and there is a question in there about social isolation and loneliness, so they're able to look at those results. And then with the Men's Shed in Juneau County, they also have a survey for the folks who participate, and they were 100% of them said that they were feeling more connected, and they might be looking to incorporate the tool in the future, but they're not doing it right now. Some of the barriers that came up about implementation were sometimes these questions might feel a little intimidating to the screeners themselves. So that was something that would have to be addressed when training people how to do this. And some of the other barriers were, you got to have an idea, resource, something, intervention in place in case someone screens high, because you don't want to just screen someone and be like, hey, it sounds like you're isolated, and then have nothing for them. So that was part of it. And then questions came up about what would I do with the data later? And then they came up that a lot of the folks who are doing the screening are not actual social workers, so they do need to have information about resources and also relationships with folks that they can sort of do a warm handoff to make sure people get the help that they need.
Thanks, Carmen. Sally. Oh, you are muted. You're muted, Sally.
Some of the similar things. Obviously, having staff to be able to do this and finding the right place, so that is not always obtainable. Also, again, what are those resources, and should we have a toolkit before we're kind of going through the screening to be sure that we have those resources? There was one disability provider who did do the pilot, and then they went on to use that, but they did find that people with IDD, it was a little bit difficult that there's more explanation that needs to go in, and they kind of have not been using that, but have been using another screening tool or kind of questions, more of those conversations. The Alzheimer's Association person was there. She said they use a different screening, but is interested in this. And then Nathaniel talked about making sure that it's in plain language for people with disabilities so that they understand whether it's the screen or the tools that come after that. And then I think there was that conversation about making sure that you're using the data so that when you collect the data, that you're sharing it with others, you're seeing, you know, what differences are happening, how it's going, and that everybody's on the same page around the data. So, so that was the feedback from my group.
Awesome. Thanks, Sally. Erin.
So in our group, no one is using the UCLA tool either. We had one person who was using the Prepare tool because that is already in Epic. So that's good to know as well. There were some discussions about the UCLA tool and whether adapting the tool would alter the validity of the tool from the research. So some concerns about that. And then as we discussed, kind of like a lot of people were indicated that they were interested in screening for this or using a tool. So we discussed how they would identify what tool that they would be interested in. And they talked about trial and error, making sure that it was easy to use, that it was brief, they mentioned the UCLA tool would be good because it was only 3 questions. And then really looking at the evidence for any of the tools, making sure that it was a validated or evidence-based tool. And looking specifically at, like, for the UCLA one, how UCLA recommends using it in a community.
Awesome. Thanks, Erin. And my group, again, no one had been using this screening tool. There were some concerns about staff time and capacity and not wanting to just screen and then not have the resources available after that screening if someone does screen high. There are some comments, maybe they could implement the screening in a Parkinson's exercise class or other classes, and then some conversation too about just educating some of these groups about social isolation and loneliness, or even just about inclusion and making an effort for inclusion and having conversations with people at senior centers or wherever it might be, and just trying to connect people there. So some concerns about the implementation with just, again, that staff time, but interest in screening and kind of seeing how this might work in some different workflows. I know we just have 1 more minute left, so I hate to wrap up this conversation, but if there are any questions or comments about the screening tool, you can always reach out to me and I can connect you with the right people that have done the screening tool. I'm sure Brown County would be happy to answer any questions too. But just wanted to wrap up briefly with some reminders. So again, we do have the nationwide network of champions that you can join. We have a Wisconsin-based community on there that you can chat with people throughout the nation about social isolation and loneliness and social connective activities. We have our Facebook page, and our next meeting will be on October 15th. So I will be sending out the recording for this meeting sometime either this afternoon or tomorrow. If you were forwarded this meeting invite or the recording but haven't been receiving any emails from me, definitely reach out to me and I can make sure to get you on the list. But thank you so much, everyone, for the great conversation and discussion today about screening for social isolation and loneliness. Have a great day, everyone.
Thanks a lot.